So today, a bit of an agenda, but we'll think a bit about the mental health of children and young people. We'll put that in the context of understanding emotional development, the impact that it has on families and society, and then some ideas of how we might be able to work together, followed by answering your questions. So briefly, I don't think this is a secret that mental illness affects lots of young people, and they make up quite a significant portion of people receiving mental health services from psychiatrists, general practitioners, and clinical psychologists, and other allied health providers. And I think we're all aware of the impact that COVID has had on mental health of everyone, and especially young people. This is data from the survey of the well-being of young people, and this is from 2013, 2014. I'd love for an updated version of this, but there's 13.6% of people surveyed with some sort of mental health disorder of those aged between 4 and 11. And these disorders range, commonly as ADHD, anxiety, conduct disorder, or depression. 13% is quite a lot, and it's a bit scary actually to think about how many young people are having trouble with their emotions and what impact that might have in the future. So let's think about that in terms of emotional development. This is, I really like this slide, to think about. These are actual slides of brains and density of brain cells to illustrate how quickly brain cells grow and connect even in the first 2 years of life. I really like it as well because it highlights the fact that emotional learning starts from in the womb. And so, the old understanding that babies were just these blank canvases that did nothing, they are actually, those early years and the early period of their life are actually crucial in their emotional development. So how do we think about brains and emotion? Paul MacLean, a guy called Paul MacLean, coined this idea of the triune brain. And I think it's a really helpful way to think about that. So the lowest level of our brain, we call a reptilian complex, we share with reptiles, and that's a brainstem and spinal cord, and the lower levels of our brain, effectively in charge of keeping our body going, keeping our organs alive. Then the next level of brain function, we will say, is the mammalian brain, or the paleomammalian complex, which is there for the most part, when we're born as a baby and as a toddler, and that's in charge of emotion. So emotion is a mammal's primary way of survival. So anxiety is the reason why we're alive, because it helps us to run away or fight or avoid potential dangers. And then what happens later on in our lives is we grow, the much more complex part of our brain that separates us from other mammals. And these parts of our brain, have quite specialized functions. So, and the one I want to focus on right now is the frontal part of our brain, which we associate with logical thinking. So the idea being that the middle part of our brain that's in charge of anxiety and in charge of emotions and in charge of survival is an automatic functioning part of our brain. It'll do what it needs to do. But the front part of our brain will need to connect. So these connections need to occur for that to regulate that. And so the parts of our brain that's in charge of that is, the deeper parts, which are in charge of regulating feelings. And then the outer part, which is in charge of executive function and motivation. So you might find that, that people who have frontal limbic, so the limbic region is another name for that emotional brain. So the people who have difficulties with connecting their logical and their emotional brains will have problems regulating feelings and might also have symptoms of ADHD, which is what we apportion to this executive function part of that frontal lobe. So in effect, the core part of brain function in terms of regulating feelings is connecting the front part of your brain to the back part of your brain, and which is, we jokingly call you mullet ratio, that the business end of your head needs to be in charge. Okay, now what happens? As this is a slide from Stephen Porges, so some of you may know about, who talks about polyvagal theory, but this is a really useful slide to think about arousal, that as your stress levels increase, you go from being able to engage socially to needing to avoid or fight and flight and actually go into this freeze mode. Interestingly, what happens is you can reach a certain threshold where if we scanned your brain, what you see, and this is a slide from Bessel van der Kolk's book, that when you get stressed enough, that logical part of your brain will actually switch off and you're left with only the emotional part of your brain functioning. So, and another part of that here is Broca's area, which is in charge of expressive speech, which is why when this part of your brain switches off, when you're really stressed, it can be really hard to speak. So, it tells us that the mechanisms in our brain that exist to regulate our feelings might even be there. So when we're calm, we can talk about things, we can be rational, but when our stress levels increase, this can take charge and overwhelm those logical centers. So that's a really important factor to think about while we're trying to support young people, or anyone for that matter, who's going through an emotional difficulty. So what's the impact of it on our family and society? I thought about how to talk about this and how to express it. And the thing that really comes to mind is what's called the study called the Adverse Childhood Experiences Study. So I don't know if some of you may have come across that, but there's a really clever study that looked at 10 factors, 10 factors of 10 adverse childhood experience factors that they measured in a huge number of population, 17,000 people, and then tried to see if there were links to that in terms of health outcomes and health economics. So 17,000 people, and the adverse childhood experiences that they measured were 10 of them. So where you had emotional, physical, or sexual abuse, you had emotional or physical neglect, and there are, you can look this up, and there are strict definitions of what they mean. And then household challenges like domestic violence towards a mother, substance abuse in the family, mental illness in the family members, separation and divorce, and incarceration of one household member. So they use these measures as a to say, look, how many children are exposed to these adverse experiences and what happens to them as an adult. Now, interestingly, in those 17,000 people, there was 12% of people had 4 or more, and 26%, a quarter, had at least one experience. Which it kind of stresses us out a bit to think about what's happening in our society and what's happening in the homes of people, that we're all having, that adverse childhood experiences are so common. And this is a nice slide from the Anne Marie Project website that tries to summarize some of the impacts, right? And that that if you have 4 or more adverse childhood experiences, what they found in the data, health data that followed after that, is that you're 3 times more likely to get lung disease and smoke. You're 14 times more likely to attempt suicide, 11 times more likely to experience intravenous drug use, and 4 times more likely, well, I guess what we would define as more risky or impulsive behaviors by having sexual intercourse before the age of 15, and twice as likely to have liver disease. So huge implications in quite simple measures. So the impact on the community and on people's lives as a whole in terms of the adverse childhood experiences in childhood can be quite significant. And the theory that they look at here is that you can have adverse childhood experiences which disrupt the development of your brain, which then affects your social emotional functioning, which then leads you to adopting health risk behaviors such like smoking or no exercise, which then gives you disease and leads you to an early death. Now, interestingly, there's an economic toll to that because of all the costs for healthcare, but life expectancy, that people with 6 or more ACEs would live 20 years less than those without ACEs. So the impact of mental illness in children and adverse childhood experiences in children has huge implications for us. So, you know, it's always striking, and you know, this study is so fascinating to be able to give us some real world examples of the impact on that. Now, we're here to talk about parents today. So, you know, it, let's, what I wanted to do was, you know, to share with you some parent experiences. And this is from a study that was done with young people with personality disorders, and they did surveys of parents and their practitioners. And so there's some of the comments here that I think, you know, I'm betting that a lot of the parents in our forum today can relate with. So, you know, a mum that will say, then suddenly I find it makes me really irritable and angry, and then I'm getting cross with her and I'm making it worse, and then it actually feels, oh my God, this feels quite abusive. I'm shouting and being mean to a child who is here actually having a panic attack, right? Or I couldn't cope with their emotions and I couldn't cope with mine either. You know, it's, you know, so the impact on parents and the parent-child relationship can really be huge. Parents can feel guilty, you know, because you always think you're going to do better. You kind of think you can always overcome it, anything, and be the person you want to be for your children and do better than your parents did. You know, and this parent said, there are times when I find it fantastic and I feel like I'm doing quite a good job and I'm actually doing good by them, you know. Sometimes I might be taken to think I'm giving them a better chance than others by helping certain things or helping them understand the world in a certain way. But there are other times when I can't be the person I wish to be. It's really challenging. It can be really challenging to support young people with mental illness. And I'd love to hear some feedback from carers and parents about that, and whether that these comments relate to them. And then think about the type of supports that are available. You know, parents say, no, I never got no support. I was anorexic as well when I was pregnant. And I was anorexic when they were growing up in school, but nobody noticed anything and I couldn't ask for help. I can't now because they might take the kids away. You know, some real pressures. And then this dad that said, unless you use the right words and help isn't there, but they don't tell you what the right word is. You have to wait and find out. If you use the word, I need help, you'll get help. But being a man, you don't think you need to use that word. You just say, I don't know what to do about this. And that really highlights, you know, a really interesting dynamic between mothers and fathers, and how we support our young people. These comments are quite poignant because I think it's really common that parents it can be really quite difficult in terms of supporting our young people. So we think about, you know, this study made some suggestions about, you know, how can we work together, and you know, some suggestions were, you know, a focus on parent-family related supports. You know, this is an area that, you know, I feel very strongly about, because our funding models and our treatment models really are geared towards treating the individual. So, you know, if you've got a child or an adolescent who has a mental illness or mental health difficulties, then the plan needs to go to their GP and they get a mental health care plan and they have to go and see a psychologist. But that plan doesn't include how to support the parents. That doesn't include how to support their care system. And in fact, the Medicare models say that if the child's not there and I'm only seeing the parent, I can't bill Medicare for that, other than a couple of sessions at the beginning to get assessment. And you know, this connection through shared understanding as an approach is an interesting one, and it's something that we feel very, very strongly about in our work, because parents feel isolated, parents feel blamed, parents feel like they're doing the wrong thing, and at the same time they're really frustrated with their child and they feel terrible because of how they feel about their child, and having someone connect with them and develop an understanding of their child's development and why things are happening can actually be really powerful. And often that's probably the most important work that we do, because that can then, you know, help parents develop the strength to be able to do the hard work, which is to promote their child's emotional development. Access of support is so tricky, you know. Private practice clinics can be expensive, and that's really tricky for clinics to manage. How do we be accessible to to families who can't afford it, and then the public health system is so overrun that you only get seen if you're actually suicidal at the time, and then we only see you for a short while. It can be a really tricky space to manage. So that's, I'm not sure what the answer to that is, but I'm hoping that maybe over time, with the focus on mental health and increased funding, which is what we've got in the current budget, maybe that might help. Supporting children at the individual and group level is important, because supporting young people to learn skills is important, but as well, teaching them how to be with others is actually really crucial. And of course, to me, the first step is supporting parents with their own emotions. Is really tricky. So these are all big goals and big tasks. But what I wanted to finish with in this portion of the presentation, so we can focus on the question and the answer, is a bit about the process, because often parents come to clinic and say, look, we need strategies. What's a strategy that we can have to support a young person? But I'd like to say it's not about the strategies. There's lots of these pictures on the internet, but I really like this. It doesn't matter how many resources or strategies you have, if you don't know how to use them, or more importantly, if you can't use them, then it will never be enough. And parenting's hard. So, I like to think of it as more of a process. Because parenting is hard. Our task to be a parent or a carer is to always be, bigger, stronger, wiser, and kinder, and follow my child's need or follow my child's lead. But at the same time, if my child's not managing as well, then I need to take charge. Knowing how to do that can be really tricky if we're suffering ourselves from our own mental illness or other stresses. And it can be really hard to admit to needing help, and also whether that help is available. And in fact, supporting parents, in my view, is actually the primary goal of child and adolescent mental health care. So let's think about a process. I'd like to walk our audience through this, and obviously, we'd love some feedback about this too, and some questions. But let's start with how it's so important to put yourself first. It's so hard to do, so you're going to have to do your absolute best, right? But I will always stand by the view that a child's development is dependent on a healthy environment and healthy parents and healthy carers. What makes it so hard? Because, parents have their own traumatic experiences. How does one leave a domestically violent relationship or environment? How do I get therapy? How can I get any practical support, even financial support? So many challenges, but it is actually the thing that we have to focus on, because parents need to be there for the children. And if they run out of juice, then things tend to fall apart, and the goal is to end up, to hold some value for yourself, to know that you're trying your best, and to know that there may be some areas in your emotional control or emotional development that themselves need a bit of help. And in some ways, if we have self-compassion, we're more likely to accept help, because I think that dad comment was really important, that sometimes it's hard to ask for help, and even letting people know that we need help, it's even harder to accept help. So that's going to be quite a challenge for us, but a really important part of this process and the steps. Because if you're able to, if you have enough value in yourself and you're able to recharge your batteries, your task is to see your child as a growing being, separate from you, and they need your help. They are a human being who's developing, who's going through some challenges, and maybe they get overwhelmed and they need your help at that time. But it's really crucial that you see them as them, you see them for them. It's not, they are not the reflections of you, or they are not, the symbols of your success or failures. And that's a really tough challenge for many parents that require quite a bit of support and help to address. Because if you can see your child as a growing being, then the next step is accepting your child as them doing their best. that if they could do better, then they would. And if they're not doing better and they're not doing what they need to do, then they need our help. That might involve working out what skills they're lacking to be able to function in the way they should. And if they don't have that, then we help them or find help for them, or we teach them. And this is a process that needs to be repeated over and over, accepting that they're doing their best and helping them, because what the science shows is that this process is what builds those connections in brain networks, which will allow them to develop those regulation mechanisms automatically later on. Now, accepting your child doesn't mean they can do whatever they want. Except it doesn't mean, okay, well, you can just smoke dope whenever you want or all the time. It doesn't mean that. It means that we have to accept that they feel like they do, and they feel like that's the only way to get through their life. That is an important part of accepting them. But it also means that, they also still need us to have boundaries, because boundaries keep them safe. So on the one hand, we need to keep them safe with boundaries, but on the other hand, we need to support them. And by support them, I mean, sometimes the boundaries that we set, it might be taking the iPad away. The boundaries that we set might cause them emotions, and we have to accept that and support them with that. And again, that's another one of those processes that's going to be crucial for helping young people develop their emotional control. And if our young people are doing things that don't make sense, we can easily judge them. We can say, oh, why are you doing that? But what if the reason why they're not doing it is because their logical brains disconnect, and that they're overwhelmed, and what they actually need is acceptance and soothing, and us to always hold hope that, we will get through this over time. Because, in general, what we see in human being development is that brain networks will develop over time anyway. That's the nature of things. That's how they're supposed to happen. It's the experiences that we get or the repeated traumas or the repeated rejections that teach our emotional brain to hold on to that power of being automatic and switch off the logical aspects of our brain. So by soothing that part of their brain, we might actually give them a bit more chance to build those networks and use the logical centers a bit more frequently and automatically. And most importantly, it's really sad that because our young people have suffered so much, sometimes we lose hope and we write them off, and then they write themselves off, and they don't see themselves as worthy anymore or valuable. And some of them don't want to live anymore, or some of them write themselves off as I'll never achieve anything. And sadly, that does, parents and carers have such a big say in that, especially early on, to keep holding that hope despite the difficulties, despite the fact that they really struggle with their social challenges or academic challenges or whatever it might be, because for some reason or other, maybe genetic, maybe experiential, that they haven't been able to develop those skills. So that to me, is an attempt at building a process, or looking at where you might be at in your journey in terms of, how good am I at putting myself first and looking after myself, and valuing myself? How good am I at accepting my child that they're doing their best? How good am I at soothing them? Which is where those strategies come in. There's 1,001 of them on the internet, but without doing the initial bits, then those strategies probably won't work.